หญิงอยากแบบสวัสดีค่ะสวัสดีค่ะ so welcome back to Health Dialogue by BDMS and I'm Ying Nantawan working again today with us and I would like to say today the topic is very interesting and I'm here with a young guy. He is the sports scientist of Bangkok Hospital Phuket. His name is Suli. Yeah. Okay, so it's easier to remember. And today the topic is metabolic analysis for effective weight management. You may hear the topic and you may think why the lady there sitting here. So I'm one of his patients. So let's introduce yourself.
Okay, my name's Namajanaga Sihayatra. You can call me Suli. I am a sports scientist from Sport Medicine and Arthroscopic Center.
So his station is at Bangkok Hospital Phuket on the 8th floor. But why we have to talk with him? Let's discuss about weight management and as I said, one of his customer. But so many people try so hard searching information from Google and ask many experts and try exactly the same way as that guy or that lady have done. But why the success rate is totally different. So I would like to ask the expert and he will explain to us how to do effective way, right?
Okay. First, I should tell you all to know about the overweight problem.
Yes.
Overweight problem is a big problem that can cause to be the many disease.
Yes.
Yeah, like non-communicated disease.
NCD that many people like consume a lot, cannot manage weight, and it's a cause of many sickness.
Yeah, like cardiovascular disease, diabetic, or some kind of cancer. So the good weight control can help us to promote the good health, good shape, and also good life quality.
Yes. Some may say, I'm happy even I'm a little bit overweight, but what I concern, I believe so many people who are even overweight can be beauty, can be handsome, but what we concern is the health.
Yes.
Yeah, it can lead to many different diseases, as he said. Then we have to think about it.
Yeah, and so that's why many people try very hard to find the best way to control the weight.
Yes.
But mostly I think maybe about the weight loss, right? And you might have seen a lot of content from the internet or many sources that tell about the way to lose weight. And maybe you have already tried some of methods.
Many, I have to say many. It's not the secret, but I think they said people can learn a lot how to, but as we said, the result is not the same.
Yes.
So I think you know the secret.
Yeah, certainly might be certainly some of that method might be work so well, but not all of that method suitable for everyone. That's why sometimes sometimes when we try some method, we fail with the result from after trying.
Yes.
So,
I think now everyone wants to know.
So that's why the new technique like metabolic analysis is very important. This technique will use like a navigator for everyone to plan the effective weight management.
It should be better if we know and we check ourselves before starting. Okay, don't worry about the past. So start the new. Now we're gonna do kind of metabolic analysis before starting again. Yes.
Okay. First, let me tell about the metabolic analysis. Next slide, please.
You're gonna see how I have done that. Done that, and then I just start. And
okay.
Yes, we see the equipment here.
Okay. This equipment, normally we use this equipment for the sport performance analysis. Some sport guys maybe have seen this before.
Okay. So the sportsmen before training, they also have done this test to be better in some term, right? Okay.
Yeah, but now we are modify this equipment to measure the energy using from the different activity for the normal people, not only for the athlete.
I think yes, that is the best idea. I think you find out the very support thing that help people, because not only the sportsmen want to be healthy, we all also want to be healthy.
Yes, absolutely.
Yeah, it's look like the equipment is not complicated. Yeah, simple.
Okay, and next slide. Okay. This is the sample result after we test.
This one is mine?
Yes.
Okay.
Okay. This is your result after we test. From the picture, first, let me introduce you about some important part. Focus at the pie chart. This pie chart is
the pie chart is a circle one. Yes.
Yeah. The in pie chart will split to be three parts. In blue part will show the carbohydrate using. Orange part will show the fat using, and green one will show the protein loss during that activity.
That's really amazing. I have seen this chart after the test done.
Yeah, normally about the weight control, we mostly focus with the calorie, right? Calorie intake and calorie using. Yes, but
like exchange rate, for example, I should consume that much and I use that much, and yeah, but I don't know in detail like this analysis.
Yeah, this detail will different with normal calorie measurement because of we know about the source of the calorie. So we can decide the best activity for fat burning and decide the best nutrition to relate with the body needs. Yeah, from the example that we show, your result.
Yes.
Uh,
the test is very easy, I have to say.
Yeah.
I spent not longer than an hour there, but he see the different how I use the calorie, but it's not only how many kilocalorie I have used, but also protein, the percentage of protein, percentage of carbohydrate, and also the fat. Yes. And that's really amazing.
Yes, and from your result,
Yes.
We found you can burn fat you can burn fat better when you try to walk.
Yes.
But
he persuaded me to walk more.
yeah, but when you standing or when you stand or sit on the same with the same position,
Yes.
you lost more carbohydrate but
Mm.
use fat less than walking.
So the aim is we should burn fat.
Yeah. Normally when we talk about the weight loss, we should focus with the fat loss, not loss the other. Because of if we lost the other like a muscle, your capacity of energy burning will be decreased.
Yeah. I mean
So
lower.
yeah, so the good way is the fat loss, not muscle loss.
Okay.
So
The first one is
for
walking.
you, walking is the best for fat burning.
Okay.
And because of your work, cannot always walk all day,
Yes.
right? So
Office girl.
yes,
Sitting mostly.
yes. So in this case, if you sitting mostly, you should have the carbohydrate in your meal more than the fat, and control the fat in your meal.
I see.
Limit by this graph. Normally, this graph will show the how many grams of the source of the energy, so we can calculate the best nutrition plan.
So that means after all the tests done,
Mm-hmm.
you will explain everything to the customer,
Yeah.
and after that also decide the way of consume or taking meal, like how many carbohydrate or fat or even protein that we should consume every day, right?
Yes, absolutely.
That include in the program, in the analysis
Yes, all
program.
of this include in the program.
Wow.
Because of after this test, we will know, we will suddenly know the result, and I will recommend you how to finish your healthy goal. Follow this result.
Okay.
The important part. The other important part is the protein intake. You will see in the green part in pie chart.
Yes.
This will show the how many protein you should take per day. The big problem for many guys is lack of protein, especially in Asian and Thai, because of our food are not focused with the high protein
High
intake.
protein, I see.
Yeah. So
We
about
consume, we focus on carbohydrate.
yeah. Normally we focus on carbohydrate, and when we cannot use that, the carbohydrate will change to be the fat.
Okay.
And that's our problem. But the protein is the important part, because of if we lack of protein, your body will burn the protein from your muscle. And the normally muscle mass will relate with the capacity of energy burning per day. So if you lost your muscle too much, you will burn less of the calorie.
Yeah. So that means someone who cut everything and try to consume only vegetable, maybe it's not the right way. But I didn't say that you should not do that. But before doing things like that, maybe do the analysis first.
Yes.
Check your metabolic analysis first.
Yes.
Okay.
And the other special things is the next is on the next slide. Next. Okay. This slide will show the other activities. From the previous slide, we show the active
walking,
activity like walking,
and
standing, and sitting. But this will show the basic activity is sleeping.
Sleeping.
Yes.
You also can measure when we are sleeping.
Yeah.
Wow.
But that's why we show the two result, because of the quality of sleep can be different in one case.
I was very short period of time. Short period of time, and but how to say? I was there and I have to take a nap in his center.
Mm-hmm.
And after that, he find out that when I have a good sleep and bad sleep, the result is different, and the burning part is also different. So let he explain.
Yeah, because with this, in normal people who have uh, high performance to burn fat during the sleep time, we can recommend them to sleep more for lost weight.
Yeah.
Yeah,
So from my result,
yeah,
when I sleep well,
yeah,
I burn a lot of fat.
yeah,
I should sleep and kill the fat.
correct. But because of you cannot sleep well
All the
all the
time.
night,
Yes.
so the first recommend for you is that try to find a way to have the better sleep, like use some equipment like a CPAP to help
Oh,
you
for
sleep
those.
better.
I mean, for those who has a problem or difficult in sleeping, or snoring, or obesity, for example, and you feel tired and weak during the daytime. This is I have to share some experience. Uh, even before this metabolic analysis, you have to do the sleep test. I have done that, and I find out that in the night I cannot sleep well. Sometimes shut off oxygen and fight a lot, and that means bad sleep. And I burn instead of fat, but I burn carbohydrate. And even I sleep for 4 or 5 hours per night, but it's not a quality one, a good quality one. So in the daytime, still weak and tired, and that I find out, and I use the machine, so it's help, and then I can sleep well with that machine. So it's called CPAP. That's why. Okay.
Okay, and for now, because of normal in your normal sleep, you
Yes.
cannot have a good sleep all night. So some part of your bad sleep, you will burn more carbohydrate but
That the
less
blue
of
one.
fat.
Yeah.
This is different from the normal healthy people. But the big important thing from this will be related with your breakfast. Because of when you sleep, you burn the carbohydrate
Yes.
more than normal. So this will be related with your carb needs in your morning, in your breakfast.
Is that why I feel so hungry in the morning?
Yeah, this related.
But if I sleep well, I may not need that heavy breakfast.
Maybe not, but because of for the good sleep, you still burn the carbohydrate. So this means you will feel hungry absolutely in the morning.
Okay.
And
So it's not, I
this,
don't have to feel guilty to eat breakfast.
yeah,
Breakfast is the best.
yeah, breakfast is the best, especially for you.
Okay, thank you. Confirm.
Yeah, and with this, you cannot skip the breakfast.
Okay.
Yeah, for someone who use the method intermittent fasting intermittent fasting for diet.
That is one of the technique.
Yeah.
For those who try many different way, know
Yeah.
this kind of specific term.
Yeah. For someone who try the intermittent fasting, will skip the breakfast. But for you, if your results show like this, you cannot do like that.
So that method is not suit me. Okay.
Yes. And about your breakfast, you should try to feel more carbohydrate. Maybe you can have a big portion of carbohydrate. And the fat, and about the fat source, you still can have in your meal, but need to be controlled.
Okay.
And protein still always important.
Okay. So that is one of example that I have the test done. But as we mentioned, many people come for this test nowadays, and but it's the patient right. We cannot show everything right here, but I devote myself for him and to be on the slide, and everybody can understand easily. Okay.
Okay, and next slide, please. Oh, okay. And this slide is from the other case, not you.
Okay.
This will compare between the different case. This this
It's
example
look
show
totally
the
different.
yeah, very different. This show the extreme case that on the left side, this case can burn the fat better than normal people,
The
but
one with the pie chart with more
yeah,
orange color, right?
yeah, and have many little of the carbohydrate burning. Uh-huh. Firstly, I must tell everyone know this result show during the rest time, but from the movement or from the activities,
Even
this
burn
case
more, I think.
still burn similar like this.
Okay.
On the left side show the case that can burn fat better than normal people, but can burn carbohydrate very low. So the keto diet, the keto diet is a style of diet style that eat only protein and fat, but cut off the carbohydrate.
Is that suit him better, right?
Yes,
Because he cannot burn
the keto diet
well. Yeah,
suitable with
with
this
this
case.
guy.
Yeah,
Okay.
but for this guy is very lucky guy because of if he want to eat more carbohydrate, he still can do because of normally when we eat carbohydrate and we use it, we cannot use it all. Your body will change the carbohydrate to be the glycogen and to be the fat also.
Yes. And he still can burn fat.
Yeah, so
Okay.
this so he can use the many
Yes,
way
you are lucky,
of
really.
the diet style, but on the right side is the very different because of this case can burn more carbohydrate but very less of fat. I have already told about the fat burning. If you eat carbohydrate, you still can change from the carbohydrate to be the fat. But if you eat the fat, you cannot change the fat to be the carbohydrate.
Yes. So
So on the
that guy is lucky, but this lady not.
yeah,
Exactly.
this the result on the right side we show this case cannot eat too much of fat. So the low fat diet is suitable.
Let's discuss the second case. So what kind of food or meal should she take?
Carbohydrate.
Carbohydrate.
Highly carbohydrate is very work for this case.
Rice, noodle, pasta, pizza, but less fat.
Yeah, less fat. Maybe for pizza maybe not good as well.
Because of the topping.
yeah, still have the fat, but pasta with the tomato sauce is okay.
Yes,
but
yes.
if you like to have the carbonara, it's maybe not worth.
Is that a good idea?
Maybe you should limit the olive oil when you
see that
have
after we have done the test. What kind of test can you tell me again? What's the name of the test that they if our customer come in and want to do the test? What's the name of the test and how should they request?
We call this test by customized metabolic analysis. Or sometimes we call individual metabolic analysis. And if you want to test like this, you can tell at the register or call to the sport medicine center to ask about this for more information.
Okay. As I always inform you, you also can scan and be our friends in our expat links. And also you can reach us by 1719 if you call us from this station. But if you call us on or in other province, you may reach other hospital of BDMS group. But I mean on Phuket Island, 1719, ask for sport medicine. So they will connect you. And if you cannot remember all the words, just remember his name, Suli. He will help you to find out. And after the test done, he also helped to design way of, as we say, activity and also nutrition, and we can manage things better. Okay.
And about the preparation before the test. you can come without the preparation needs.
Just booking.
Just
Yes.
booking.
I don't have to fasting. Like
Mhm.
I allowed to eat what I like, what I want before come to see you, right?
Yes, you
Ah.
can do everything normal
No blood
before
test?
come here. No blood test,
Ah,
no
no
pain,
needle.
no something hurts you.
Okay.
Okay, and after you book, you can come to test. Or you can book only on Monday to Friday.
Okay, so like office hour from 8 o'clock
8
to
to
4
4.
o'clock. Yeah.
Yeah.
Okay. I have done this test before. So the time he used
Mhm.
only half an hour, but give us the time like you step into the hospital, blah blah blah.
Mhm.
All the process may be done in we finish in 2 hours.
Mhm.
Yes, and we also have promotion since I have discussed with him and his manager in the department dealing difficulty right now. We are facing a lot of problem, and so many people gain weight to dealing
Mhm.
this COVID-19. So
Mhm.
many people struggle and try to lose weight, but before, as we said, before doing or going in the wrong way, you
Mhm.
come and do the test. And I already asked for a special promotion, special price. Normally, this test costs
Mhm.
3,500 baht, but from now on until the end of the year, the promotion is only 2,000 Thai baht.
Mhm.
So don't miss it. And as we said, you may have to spend a lot of money for many different kind of method and technique. But if you don't know exactly how is your body burning and
Mhm.
function with this carbohydrate, protein, and fat,
Mhm.
maybe we gone the wrong way. So
Yeah.
do I.
Yeah, and the special thing is this test have only in the Bangkok Hospital Phuket, only
Yes,
here.
early here.
Uh-huh.
Okay.
Okay. Oh,
We
I
have a
have a
question from
question.
the floor.
Mhm.
I
Mhm.
always skip breakfast or lunch, but eat a lot in dinner time.
Mhm.
Any side effect in
Any
long
side
term?
long term? Uh-huh. Okay. Normally, about this way, look like same as many people as I seen before. And
Wake up late,
yeah, wake
spend
up late
longer time in
or
the
skip.
bed.
Okay. With this, with this, normally effect will relate with the fat collecting.
Mm-hmm.
But not much different if you still control the balance of the source of energy and calorie.
Mm-hmm.
If you, in some case, have only dinner, but the calorie intake is
Mm-hmm.
still be under the limit, so that case can control the weight. But this way may be harm to the other health problem like digestive. Uh-huh.
Yes, yes. So it's
Uh-huh.
not only the weight, but as our customer just asked,
Mm-hmm.
I think if he has done the test, maybe
Mm-hmm.
he know that if he sleep a lot, he can burn fat. Something
Mm-hmm.
like that is maybe one of the good way.
Yeah.
But we also have
Uh-huh.
to observe other function of the body as well.
Yeah, that's up to the goals that you choose to focus.
I see. So I just have the test done and I will consult him. But I heard from him that this price that he offered, 3,500 baht to 2,000 Thai baht until the end of this year. Uh, the best way is after analysis. Also, he said 3 times follow up free of charge because
Yes.
he also has to observe. I also have to see him again and again because after he designed for us activity and nutrition way, but after 2 weeks we have or 3 weeks is depend. We have to
Mm-hmm.
uh, set the schedule with him with Mr. Suli and then observe and maybe have to adjust a little bit
Yes.
to achieve the goal.
Yes.
Okay, so do you have any limitation? Who cannot do the analysis?
With this analysis, uh, if you pass the COVID-19 screening
Ah,
already, you can come. Don't
okay,
have the other limit. You can
okay.
always
So
do.
if we can, what I have done, if we can stand, if we can walk, yeah, and we can lay down
Mhm.
without assistance, so we can
Yeah.
done we can do this
Some
test.
case come and test with the laying only.
Laying position only.
Yeah, the main part is on the laying.
Uh-huh. So how busy you are? Are there many people from Phuket come for this test?
Pardon?
Are there many people coming to do the test?
Yes.
How about their age?
It's very different. Normally, it's
Vary, right?
vary from the teenage to the older elder.
Okay. So that means this is not only for, as we mentioned, not only for sportsmen, but for everyone who are focusing on good health, good chef. You can come in and you very easy to reach us 1719 and ask for sport medicine or Mr. Suli. Then make an appointment and come in for metabolic analysis. Okay, and you will have the. I think you will see the light from the tunnel, how to achieve the goal. And anything else that you want to mention?
I think I will tell my opinion first. I will tell my opinion. I think about the diet or losing weight way. Uh, many many methods are always work, but because of our method not suitable for everyone. So I think if you can choose can know the best way for yourself, it can be the fast track for you to success your health goals.
Yeah, I have to say, after I met him and I managed my sleeping uh, hours and quality sleeping, I already can lose over 1 kilogram of weight during 1 week. I think that's the right way. But I think the best way is experience it by yourself. So give us a call 1719 and stay tuned. Next week, we will come with another interesting topic. Thank you, Mr. Suli, again. Yes.
Okay, thank you.
ขอบคุณค่ะ
สวัสดีครับ
and thank you all the audience. See you again next week on Thursday 2 o'clock. Bye bye.